University of Florida is a school on the rise, and it's because of preeminence. You can feel it, and I hope you'll feel it when you walk into the new medical education building. The preeminence initiative is extremely and extraordinarily important to the University of Florida and the Health Science Center. The Health Science Center has been a leader as far as revenues in the past, and this will allow them also to be recognized much more nationally to be successful. I was fortunate enough to go to medical school. It was a public school. Somebody had paid ahead and created that opportunity and that location for me to go. And these students deserve, they're much more talented, much more inquisitive, and very much look to be there. And so I thought it was extremely important to have this facility to again foster that group learning and to make them appreciate this is a preeminent university that's going somewhere and get a buzz. One of the first things when you go into the Commons, and why I thought it was an extremely important area, is the first thing when you walk in, you feel this openness, you feel this light, you feel this almost hope. If you would have walked into the last building in the basement, it would have not been the same. It may have been the same once you were inside, but your first impression was not necessarily a good one. Now you walk in and you go, this is so refreshing, this is so amazing. It starts you off your day or your time there with a very good feeling about where you are, the aesthetic of the look, the views, the light, all those things are important. I want to start out, whether it's a nurse practitioner or a PA or a nurse or anyone else who enters that building, to really feel empowered and enlightened, literally, and look forward to being there and seeing the rest of it. If you look at the design, it's very different than the old classroom design. Not nearly as many big conference rooms or big lecture halls, and many more small spaces with technology for these students to gather. So I think this will make a difference in how they learn, and Dr. Fantone has done a great job changing the curriculum, and I think this will fit very nicely with the new medical education building. This whole facility will lend itself and teach us about better communication, better safety. When we transfer patients from the operating room to the recovery room, or from the pre-op room to the operating room, or whatever, all those experiences have to be safe. And in the past, we didn't necessarily focus on that. So I think we're doing a great job. And Dr. Good, Dr. Gussick, Dr. Fantone, and of course Ed Jimenez have all focused on raising the total quality since Dr. Gussick and Dr. Good have been there to a whole new level.